of learners to school. The council earlier stated that schools in the province were not ready, with many of the essential preventative measures still outstanding. This will be the first time that Education MEC Boshielo outlines her department's plans to prevent the spread of the coronavirus as learners go back to school. For more on the story, let's cross live to that briefing.
By the safety of learners, teachers, and support staff in our schools, whilst ensuring that the reopening of schools does not contribute in any way to the spread of the coronavirus. The risk-adjusted strategy requires us to maintain a delicate balance between saving the lives and saving the academic year. It requires a greater responsibility and discipline from all of us, parents, caregivers, and guardians. The virus has challenged our traditional ways as a sector and has imposed on us a new normal. A lot of effort has also gone into preparing of our education system to adequately respond to the demands of coexisting and thriving against the virus, whilst we hope and pray that medical experts make a breakthrough towards a vaccine. Our efforts were strengthened by consultations we have had with various stakeholders to ensure safety and protection of all educators and learners. We have been part and parcel of the around-the-clock work that has been taking place at national level in the Department of Basic Education in setting up guidelines and operating procedures for our new normal. At provincial level, the Department of Education has established work streams that mirror the national arrangement to look at how our infrastructure can accommodate social distance and hygiene requirements, curriculum plans, examination and assessment, school nutrition program, learner transport, communication and psychosocial support to learners and staff. We have also had to look at how our current limited funds could be moved around for us to afford basic necessities required for the reopening of schools. The new normal has also demanded of us to strengthen stakeholder engagement as we still rely on them to help actualize our plans. This route runs through to our ascension that education is a social issue. Consultations between the department and all relevant stakeholders have been going on ahead of the reopening. We have been throughout this process engaging with various provincial departments, organized labor, learner formations, associations of schools, governing bodies, and the private sector, not only to share plans but also have them on board in ensuring that our education environment becomes safe for teaching and learning, and that the safety and protection of all educators and learners is not compromised. Our reopening of schools plans have also passed through the scrutiny of the Portfolio Committee on Education, who also emphasized that matters of safety across and the protection of life must be prioritized before schools resume. The department presented progress reports on a weekly basis to the Provincial Command Council on our level of readiness to receive grade 7 and grade 12 learners to more than 3,700 schools across the province. At the last Provincial Command Council meeting, The department indicated that it was still finalizing consultations, after which we shall be able to brief the people of Limpopo, as we are doing currently. So that everyone is made aware that indeed schools are reopening and what it literally means under these current circumstances. Obviously, we expect everyone to play some role in ensuring that learners are safe when at school and when at home. Having said that, we are joined by both MECs for Health and MEC for Education, who will take us through some of the critical details that our people need to be enlightened on. Thank you. Hey, that echo. Okay. All right.
Thank you, Premier. We'll then request the MEC for Health, Dr. Koperona Tuba, to take us through the protocol of assistance to education and what is currently happening at schools and the assistance that are giving. When she's done, the MEC for Education, Ms. Boshielo, will take us through some of the protocols and technical things. Thank you.
Who's first? Well,
very much. Special greetings to our Premier, my colleague, the MEC for Education, the members, colleagues from the media, different houses, and all of you who have joined us through virtual connection. As a Department of Health, as the Premier has indicated, through the Provincial Command Council, we were tasked with the responsibility to look at the state of readiness in terms of whether it's any industry that is going back to work, whether it's schools, our learners going to schools, and indeed we develop a back to work and also a back to school guidelines and policy to advise all sector departments to be able to attend to that. And I must indicate that the issue of education or going back to school is a sensitive issue which we know the interest, even ourselves where we are seated, we are parents. As such, we know everyone it's highly interested. That's why we did not just look at it as whether it's an issue of us to comply or not, but look into the scientific issues and from the relevant expertise within the Department of Health. In this case, we met with our pediatricians in the province so that they can guide us, and also we have gone through what the South African Pediatric Association have indicated, because this is an association that throughout the country organize the pediatrics. These are the doctors who are responsible for children when they are sick. So we don't think that those will definitely advise us wrongly so, because it is their responsibility to make sure that the mortality rate of children in this country goes down. So there's no way that they would say to us, take kids to school when it's not correct. So it is against that background that after we've met with them, we have been able to present to education to say what we believe, and also to the Provincial Command Council, which is led by our Premier. What they are saying, the advice, it's very clear that majority of our children who are infected with SARS-CoV-2 will not get sick. And even those that will get sick will have just minimal, mildly sick, or you rarely find any child who is severely sick if infected with SARS-CoV-2. And also those children who are infected with SARS-CoV-2, whether they are sick or not, they seem to be less likely to be infectious. So which to us, we interpret it as follows, that it is rarely that you will find that a child will get infected because of the teacher, or the child will infect the teacher. That's what we could make that conclusion. And not that it doesn't happen, but we are saying the rate at which it happens, it will be those rare cases that we will find across. And then the implication of those findings to us was to say children are unlikely to be very sick if they get the virus. And also the teachers are not at high risk of being infected by the children. So the opening of the schools in other countries, when we look at them also, we have noted that you don't have that major outbreak. I've seen there was an article that France, 70 kids throughout the country. You're talking about 70 children. But in the country in South Africa, we're talking about there is a mine which opened and 152 people got infected in one day, one mine. Here you are talking about 70 learners across the country. So we said, let's look at all those factors before we become emotional when we deal with this particular matter. It needs us to look deeply through it and analyze it. And we are also saying that COVID-19 pandemic in South Africa has not yet reached the peak. So when we say we must allow it to go down, to slow down before we open the schools, the chances are it will not slow down now or in the next 6 months. So to say allow it to slow down, it's just, we might agree all of us to say we forfeit the whole academic year, because we can't. And as the Premier has indicated there, when are we going to get the vaccine? We are really not sure as to when exactly. And therefore, we then are saying there are more benefits of our learners going to school. If I come down to the province, maybe I might sound insensitive, but the Premier will defend me after I would have made probably a reckless statement. But just to say, we have now gone to level 3. And we did an observation just this morning to see the impact of alcohol sales yesterday. As I'm speaking here in the province, we have dealt with 18 sexual assaults who were related, linked to alcohol. We have also dealt with 16 domestic violence, which had linked to alcohol. I'm not talking about the ones that are not linked to alcohol. There were 8 drunken driving, just for one day, in Limpopo province. I'm not talking about the count. We also experienced a 1 gunshot. As we speak now, the surgeons are still in theater to try to rescue this particular gunshot due to alcohol. And when we analyze the age of those people who are involved, they are our children. These are the children that are supposed to be under lockdown. We are saying we can't let them go to school because they might get infected. But now, when the alcohol is out there, our children in our villages are in the shebeen as we speak, because alcohol is now available and they are indulging in alcohol. So the benefit of having your schools open, the children will be at school and they will spend time at school, not in our theaters when we are trying to save their lives. Because you might say you are protecting them from COVID at school, but you're not protecting them from COVID in a shebeen. You are not protecting them from dying of gunshot or stab wound. So we are really saying that our advice as a sector department is to say the pediatricians have spoken. We would want to believe and trust them because they are expertise when it comes to diseases of children. And they have also recommended, and we are also recommending to MEC for Education to say, if we follow the few guidelines that I'm going to raise here, those are the ones that they will respond to. And if they are able to respond to those, we believe that we need to open our schools and let our kids go to school. We are saying if the schools can be able to practice social distance, at least the kids can sit 1 meter apart so that they will reduce. So we have seen that they are saying they will only start with grade 12 and 7. meaning they will have classes to can do that. And we are also saying let's reduce movement of learners from one class to another. Rather, let's have our teachers to move from one class to another. The teachers must follow the learners. And we are also saying regular hand washing with water and soap. And I know many of you are going to ask, MEC, where is your water and premium? The issue here is to say where we don't have water, let's provide hand sanitizers. And we're expecting the MEC for Education to make sure that we do have hand sanitizer in those schools that we will not be able to have water to can wash our hands. And while we are saying all our schools must be able to have water and must be able to have a proper sanitation, but we are saying for now, let's get all our kids to have hand sanitizers. We are also saying, we know that everybody was saying we need to clean the schools now, disinfect them now before we open. To us as health, we are not really much religious about this because the issue that we are raising here is to say, while yes, we need to disinfect, the question is, it's day number 60 something now under lockdown when the schools were empty. As it is for now, we just need to clean the schools, not necessarily the disinfection or the decontamination of the schools. What we will need is to say once the school starts to function, we must be able to monitor that on a regular basis. The surfaces are being cleaned with water and soap and also regularly so that they remain clean. But the issue of saying you must first disinfect before we open, I think it should not necessarily be used as a guideline to say we should open the schools. We are also saying they must close the grounds and cancel all non-essential activities so that we don't have more playtime from our learners. We are also saying we've already indicated that the kids must keep in the fixed, and if we can stagger our times to say the time for breaks, they don't go at the same time to go into their break and participate. We are saying that. And as we conclude, we are also saying most children, including those with asthma and allergic conditions, even those with HIV, can return to school. There are children, and it's not a large grouping, with severe heart disease, with a renal problem, whose immune system also is compromised, those children with cancer, those children whose HIV is not manageable or controlled, the virus is not being suppressed because probably they could have been defaulting of ARVs and so forth. We're saying those are the children that should not be able to go to school, and they must consult us, the parents. You consult us as a Department of Health. We will assign a pediatrician to look after that child and be able to advise accordingly as to what should happen to that. But even other, that goes to even the teachers who feels that they've got comorbidities, they will not be able to teach. They must be in the classroom. We are saying to most of our teachers, you are unlikely to get infected from your learners, but you are likely to infect each other in your staff rooms. So before we say kids are going to infect us, let's just go through these recommendations that we get from the expert to say we must first cut even the staff room, meaning the teacher must go to classroom, teach, and then go without interacting with other fellow colleagues, because that can be risky and can be very dangerous. We are also saying all the children who are sick, either got fever or cough or sore throat or diarrhea, including the teachers, they must immediately be taken home and for us to be taken to a healthcare professional, a nurse or a doctor, so that we can examine and test for COVID. They should not be, and then we'll follow the other guidelines of any other. We will, as the Department of Health, support education on their first day of school so that we can go and monitor how they are screening. We will provide them with our screeners who have been screening throughout on that particular day, so that they translate the confidence to the screeners who have been trained by Department of Education from their education will be able to take over. But we will therefore support them on day one. And symptom screening must continue on a daily basis, and we should be able to screen everyone daily. And we are saying, if we work together on this one, we will be able to. Where we are sitting as the health department, we do support the decision by the Department of Basic Education to say, let's stagger our learners and let them go back to school, because the very same kids that we are saying their schools are not ready are the very same kids who cannot access e-learning. What we learned as the Department of Health and also through the PCC is that in this country only 20% of children are able to learn through e-learning. So I'm asking myself, and I asked my Premier, if I didn't go to school, where will I be sitting in this chair? It's very rare. So let's allow all those rural children also one day to become us and be given that opportunity to learn and study, because it's only education that can be able to change, unless we want to continue the cycle of poverty by denying them accessibility when we know our children are learning at home through e-learning. Thank you very much.
Thank you, MEC. Thank you, the Minister for Education. MEC Boshielo, with there are people hard of hearing, they're reading your lips. So with the thank you, MEC.
Thank you very much, Mr. Matiba, Premier. Peace job. Yeah. Can we go? Yes. All right. Thank you very much, Premier Chupu Matabata, my colleague, MEC for Health, Dr. Ramatuba, members of the media.
See the MEC on the line?
Yeah, the camera is off.
Oh, yeah, just off. The mic is muted.
Premier must be off. Thank you.
Thank you. Once again, good morning, Premier, my MEC for Health, Dr. Ramatuba, members of the media, ladies and gentlemen, good morning. Allow me to start by indicating that indeed these are difficult times, a difficult and a challenging period for the education sector, society at large, as we are all called upon to learn to live with COVID-19, as the MEC of Health have indicated. As the Minister of Basic Education announced on the 19th May 2020, the phased-in opening of school starting with grade 7 and grade 12 warranted that we embark on a consultation process with a number of stakeholders in a manner that will ensure ownership and cooperation in terms of the new normal that confronts us. I think Premier have gone to length to explain this. We have done so and have engaged all our strategic stakeholders. The work we do requires greater responsibility and discipline from all of us, especially parents, caregivers, and guardians. The measures that we have put in place require complete cooperation from all of us in ensuring that the safety of learners and everyone in a schooling committee is assured. As a department, we cannot adopt a know-it-all approach on this. Readiness to us means everyone must be on board in protecting our learners and ensuring compliance, as we cannot afford to risk their lives in our facilities and schools. So we understand the criticism, anxiety, and the confusion with regards to our readiness. Led by the Premier Matabata, we wish to take you through where we are as we build towards the reopening of schools next week as per the phased-in approach. The Limpopo Department of Education has 51,670 educators responsible for 690,000 learners in the province. We have a total of 3,744 schools spread across 10 education districts. In Capricorn North, we have 439 schools. Grade 7 learners are 11,560, grade 12 8,205. Capricorn South, 435 schools, grade 7 learners, 6,867, grade 12 learners, 10,849. Mogalakwena, we have 246 schools, grade 7 learners, 6,955, grade 12 learners, 4,009. Mopani East, 353 schools, grade 7 learners, 14,210, grade 12 learners, 8,565. Mopani West, we have 319 schools with grade 7 learners, 11,905, grade 12 learners, 7,370. Sikukuni East, we have 434 schools, grade 7 learners are 13,861, and grade 12, 8,200. Sikukuni South, we have 445 schools, grade 7 learners, 13,789, and grade 12 learners, 9,391. Vembe East, we have 518 schools, grade 7 learners, 16,534, grade 10 learners, 11,795. Vembe West, we have 392 schools, grade 7 learners, 13,140, grade 12 learners, 8,795. And Waterberg, we have 163 schools, grade 7 learners, 6,964, and grade 12 learners, 2,804. So the total schools are 3,744, grade 7 learners, 125,759, grade 12 learners, 79,983. We have developed a plan in line with the Department of Public Service and Administration return to work guidelines after easing of the national lockdown. To that effect, critical and essential staff at head office, district and circuit offices has been reporting under lockdown level 5 and 4. All SMS's members have returned to work in order to support our schools. Currently, we are consulting and finalizing on a schedule for return to work for other employees under level 3 using the principle of staggering in and rotation. Screening is being done at all premises and all office-based staff have been issued with PPEs. The Department of Health have provided training to officials from district and circuit offices on screening. Health and safety committees have been established at all levels of operation to deal with COVID-19 matters. The process of reorganizing offices to allow 1.5 meters social distancing is also underway. This will be undertaken as guided by the direction issued by the Minister of Basic Education in terms of regulations made under the Disaster Management Act regarding the reopening of schools and measures to address, prevent, and combat the spread of COVID-19 issued on 29/5/2020. School management teams and educators were directed to report for work on the 25th and 26th May 2020, respectively, to start with preparation for reopening of schools. We are at this point expecting grade 7 and grade 12 learners to be in schools on the 8th June 2020. In terms of our hygiene packs for school, the department is responsible for the provision of the following COVID-19 essentials for all departmental offices and all public schools within the province: hand sanitizers, infrared non-contact thermometers, surgical and cloth masks, face shields and visors. A total of 153,855 1-liter units of sanitizers were procured and already distributed to all public schools for grade 7 and grade 12. We have procured 3,767 infrared non-contact thermometers and delivered one per public school. The department has also received a donation of 800 thermometers and 19,370 cloth masks from Anglo-American on the 30th May 2020, meant for the following circuit: Mwabe, Muroke, Mapila, Mogodumo, Makhulering, and Tabazimbi. The department is to provide 2 cloth masks to each learner, educator, and support staff. We have delivered to all of our educators And those who have not yet received theirs must check with their circuit offices, because some of the principals and teachers have not reported to school, so there is no way in which they can get their PPEs, but they must then report to schools and their circuit to receive them. And due to the recent vandalism in our schools, masks for learners will be distributed over the weekend. Every educator and all grade 7 and 12 learners will also get one face shield or visor for use during lesson presentation. This was done because Premier wanted us to be extra careful and safe for our learners. So the Premier insisted that we must give learners the 2 cloth masks and also the face shield in order for them to be safe. We've already procured them and will deliver them over the weekend. Last month, we appointed companies in our province to provide PPE as per the database of the provincial treasury. Safe to say, most of them disappointed, but we were able to get the supplies that we wanted. On average, 2 screeners are appointed by school, taking into account the learner enrollment. As I've said, the enrollment is not the whole school, it's only the grade 7 and grade 12s. We are mopping up on training of identified screeners and also working on long-term arrangement for this and other forms of administrative support for schools. In this regard, we have advertised 1,000 administrative support posts, which is closing on the 4th of June 2020. The collective agreement on comorbidities have been endorsed and adopted by the ELRC Council on Saturday, 30 May 2020. We are waiting signing by all parties. The collective agreement has a form that qualifying educators will use to apply and attach a medical report by a doctor. The application will be adjudicated by the health risk manager, as the MEC have said. As the Department of Education, we don't have expertise to check whether a teacher, the comorbidity is true or false, so they will assist us in that regard. The department has 720 excess teachers, 100 ad hoc, and 115 substitute posts that will be redeployed and employed to fill the gaps that will be created as a result of the approved comorbidities. Districts have databases of unemployed educators, and application will be invited from them and other qualifying educators to fill the gaps where necessary. In terms of comorbidities for learners, we have already developed a learner health questionnaire on comorbidities that was sent to school so that parents or guardians can complete, sign off, and return them to school, whereby they either disclose any chronic illness or declare the health status of their children. The department shall provide educational support in case there might be affected learners in this regard. In terms of learner transport and nutrition, the department held a teleconference with service providers for learner transport on the 15th of May 2020 to guide them on social distancing and good hygiene practices as they ferry learners. We have also held another meeting with the National School Nutrition Program, what we call feeding scheme, service providers, to inform them about the health and safety measures during the COVID-19. It was emphasized that they should continue to use closed vehicles, which must be cleaned and sanitized daily before they deliver foodstuff. The department further shared with both SNNP feeding scheme and learner transport service providers the phasing-in approach of the reopening of schools and all implications thereof. And I must mention, Premier, that some of the service providers were complaining that the number of learners they used to ferry are too low, because in some schools only 88 and 20 using, and they said they will be losing some of the money. In terms of cleaning of offices and schools, a directive was issued to schools to use norms and standard funds to appoint cleaners and procure cleaning materials. I must hasten to say that as the Department of Education, we don't have any budget for COVID-19, so we are using what we have at the moment. And progress reports sourced from all districts indicate that all schools have been cleaned except for a particular case in Mopani East, Lesedin Primary School. The school is in a mine which is closed. The school is generally deemed
not ready to open, and the department is still engaging with stakeholders for alternative arrangements that can be put in place for learners. In terms of water and sanitation, 524 schools with critical water supply challenges have been identified. The Department of Basic Education, through the partnership with the Department of Water and Sanitation, is providing 473 with tanks out of the 524, and 51 were found to have water tanks. Lebalelo Water Association delivered 20 tanks on Sunday, completing an overall delivery of 47 over the weekend. 27 more water tanks were delivered yesterday, bringing the total number of deliveries to 74. This is still work in progress and will continue to update these numbers as it unfolds. Currently, 515 schools have pit latrines, and these schools have been identified at schools risk for COVID-19. The Department of Basic Education will be hiring ablution facilities for 300 schools, and as the Department of Education in Limpopo, we are responsible for the 214 schools. And I must say that in terms of the advertisement adjudication for the 215 have been completed. We're waiting for June 1, where in level 3, the contractors will start the work. And Premier must say we have given the contractors their letters to start with the toilets of the 250. And we have also finalized the appointment of service providers for these schools, which we have engaged them to start with construction immediately. We have also worked on arrangement with the Department of Basic Education to provide temporary toilets for all these schools while we finalize on commencing on construction. And in terms of the examination and assessment, the postponement of grade 12 May-June examination by Department of Basic Education will put a strain on the management, administration, and conduct of the grade 12 November-December examination, as these two examinations are going to be meshed. The implications are dire, as the number of candidates will be 178,419. It should be noted that the May-June examination are equivalent to the November-December examination in all respects, and the standard of these two examinations are the same. Both of them are conducted in terms of the relevant regulations, which must be strictly adhered to in all processes and procedures. Social distancing has to be practiced for this group, which means more classes will be needed. The COVID-19 pandemic has also forced us to accelerate our efforts towards embracing the fourth industrial revolution. Access to technology is no more a privilege but a right. Thus far, the department has begun to lay a technological foundation that will enable us to achieve goals captured in our e-education strategy. The Limpopo Department of Education, the GITO from the Premier's office, and CETA have crafted and presented a provincial strategy for continuous learning during the lockdown and beyond to the Provincial Coronavirus Command Council. The strategy looked at internet connection across all levels of operation in the department, supply of working tools for educators and learners, procuring the necessary software and subscription of e-learning platform, assistance for children with disabilities, and online scholar admission. Our audit of available ICT equipment in schools shows that we currently have 12,609 tablets, 14,966 laptops, 14,676 desktops, and 1,014 interactive boards across the province. The department has made significant progress towards procuring of the required tools and recently received delivery of 8,491 tablets for math, science, and technology schools. I'm happy to share with you that we have thus far managed to get 33 schools connected to the internet and another 18 still in line to be connected through the South African Connect project. We also have 2,000 Wi-Fi routers with monthly 50 gigs bought for school management systems, SABC. Installation of smart classroom also is on course. We have selected 106 secondary and primary schools at which smart schools will be installed. we are glad to announce that this project is nearing completion. Already the platform has been activated using grade 12 learners and staff from the S.J. van der Merwe full service schools. Piloting and robotics, the department also have selected 110 primary schools and 2 teachers per school to pilot coding and robotics by the end of this financial year. The Office of the Premier and CETA have agreed to work with the department in supporting its efforts to make the piloting of coding and robotics in selected schools a success. A pilot report will be provided at the end of this financial year. Installing smart classroom and providing gadgets to managers, educators, and learners does not necessarily lead to enhanced exploitation of the virtual space. It is people factor that matters. Hence, the department's investment in the following training and development activities. We have appointed ICT champions for schools. Thus far, 759 ICT champions have been appointed. We have trained teachers in ICT integration. The department has capacitated 2,777 teachers, inclusive of the 801 who enrolled with Wits University in February 2020. And the training on online facilitation has commenced with the training of head office and district lead facilitator on online facilitator course to roll out the COVID-19 orientation program to all managers, educators, and learners. The department also intends using the same capabilities to train educators to roll out the reorganized and trimmed curriculum. The terms of reference of the Limpopo Provincial Government Mining Industry Type Team include skills development, collaboration on broadband and e-learning, and provision of learning devices for learners and teachers. Mines are currently presenting plans on how they can collaborate with the Department of Education on skill development, especially on starting mining school at a higher schools, at secondary school, and rolling out broadband in communities. Those parents who don't want to bring their children back to school, home education is a program alternative to attending public or independent schools, where a parent or a learner of compulsory school-going age may provide education for their children at home. We have systems in place to assist parents who are opting for home education. More information can be found on our website. In conclusion, I am confident that after having engaged and consulted with our stakeholders in terms of what is required in schools, we are ready to welcome grade 7 and grade 10ers, grade 12 learners on the 8th of June 2020. The cooperation of parents, participations of parents every step of the way cannot be overemphasized. This new normal demands that we work together every single day. We have set up a war room at our provincial office that will collate status reports from circuit on a regular basis to enable us to troubleshoot and intervene in special cases of non-compliance with safety protocol by any of our schools. I must also mention that if a school is not ready for opening, we will not open it. We can't compromise safety of learners and teachers. And there are phones there on our website where our communities can use them when they require urgent intervention. What remains at the end of it all is that we will not allow any school to open if it doesn't comply. Thank you very much.
Thank you very much.